I've worked with a lot of different models of care, and I have to say that the model that we have at St. Mary's is the best model I've seen. It's really about what they want their experience to be and what they want their birth to be.
For Grand Junction being in a more rural area, we have the ability to provide really high level, high acuity care for women's health. We can respond to any delivery, any emergency, any patient firsthand within moments. That's a really nice resource to have.
I feel like especially for obstetric care that we are highly trusted because we can keep long-term antepartum high-risk patients here instead of sending them to the Front Range or Salt Lake City. My focus with my patients is getting to know them and what they want their experience to be like and really be that patient advocate once they are in the hospital setting, to just be that partner that can help them make safe decisions for their care.
Team is solid. We have years of experience. We follow evidence-based care. We are constantly challenging each other to learn and grow. We stay well connected within the larger team.
The smaller hospitals, as a rule, have great physicians, but they don't have the Neonatal Intensive Care Unit to support the very premature babies. Those things are all available here at St. Mary's, which makes us able to the referral center for all of those complicated pregnancies in the area. I would say between Salt Lake and Denver, we're the most capable medical facility for higher risk obstetrics care because of the surgery team and especially the Neonatal Intensive Care Unit.
We have an excellent nursing staff, dedicated doctors and midwives, and just a team that really cares. What sets us apart is we really treat people like they're our family, and I think that comes across.